Hi, Jeff and Nicole. Thanks for coming by. I'm just curious, could you share who you are and what program you teach for?
Yeah, Jeff Kittelson, College of St. Scholastica in Duluth, Minnesota, and the content areas are primarily orthopedics.
Okay.
I'm Nicole Tombers, and I'm teach with Jeff.
Okay, so in the same content areas. How has PhysioU been this past few years? What do you do?
Very resourceful. Probably the biggest thing that we've been able to do with it is provide the students some preparatory work. So leading into lab situations, they get to review the videos and use those so that when we come into lab, we can be more intentional about practice as well as answering questions related to it. So I think our time has been more efficient that way, and it also gives a common platform of how to perform the test, not just seeing a picture.
Nice. Nicole, any thoughts?
Yeah, I think it's also been a little bit of an extension of the faculty while we're in the lab because students can have the videos up and be replaying them. You know, we might do a demonstration, but then it's nice for them to see what did that look like again when there's only so many of us to go around.
That's fantastic. And I'm curious, how has having access to this type of stuff affected your workload? Has that impacted the amount of stress that you have as we have gone through the pandemic? And even before the pandemic, there was a lot of stress for faculty.
Yeah, I think allowing everybody to have access to it, whether it was in the classroom or remote, to be able to access it so that you knew that you were moving along and moving forward, not waiting for another day. And that flexibility of accessing the platform whenever students want to study and whenever they can be engaged, because it may not be in the classroom in the moment, it might be later, or they might need more time on a certain area. And so I think that's been very beneficial.
Awesome.
To rework things, and I think as time goes on, it'll move the efficiency of the course in a good direction.
That's great. Any thoughts?
I think it's been especially helpful during COVID when we had really limited time in person in the classroom. And so, again, they were able to re-see things that we might have done in class and have more time to do that when they had time to do it.
Right, awesome. Hey, one last thing. If you were to describe PhysioU in one word, what would you say?
Innovative.
Okay, awesome.
Helpful.
Helpful, awesome. Thank you so much for letting us be a part of your students' journey. And we love partnering with you to create new things, working on diagnostic imaging things together. So I'm looking forward to more collaboration. Thank you guys.
Yeah,
Thank
awesome.
You. All right.